Hello, my name is Maeve Eogan. I'm a consultant obstetrician and gynaecologist at the Rotunda Hospital. Apologies that I'm not available for this webinar in person, but my contact details are there on the first slide, and I'm very happy to address any questions people may have after the event. So the title today is focusing on this choice does not just affect me, and the impact of vaccination on pregnant women. I have no financial relationships with any relevant commercial interests, but I would like to acknowledge my research and clinical collaborators, particularly Dr. Sarah Geoghegan from Temple Street University Hospital. We all know that vaccination against infectious diseases is an intervention with a very significant impact in public health over the course of the history of medicine. And the rationale for vaccination in pregnancy is that there's active transplacental transfer of maternal antibody across the placenta, which then causes passive protection from this maternal antibody for the baby in the first few months of life, and until the child's own antibodies kick in after they've been vaccinated in the postnatal period. But in addition, of course, vaccination in pregnancy has very real benefits for the mother. And we saw that particularly in the context of both flu and COVID-19 pandemics in the past. Emer has already spoken to you on the recommendations for vaccination in pregnancy, but you'll be aware of these. It's recommended that people are vaccinated for influenza at any time in pregnancy once they're pregnant during the flu season, for pertussis from 16 weeks gestation, and COVID-19 booster from 20 weeks gestation if they haven't had a recent COVID-19 infection or if they haven't had a recent booster. And the other vaccines which may come down the track include vaccination for Group B strep, which is carried by 20% of the population, and indeed vaccination antenatally for RSV, respiratory syncytial virus, to protect babies from this virus early in the postnatal period, where it causes a significant risk of hospitalization and ill health. And RSV vaccination indeed is already routine in the United States. In terms of COVID-19 vaccination, we heard much about this maybe 2 years ago, but really much less about it, I suppose, in recent months. And it's important that we, I suppose, remind ourselves of the importance of, or the place of, COVID-19 booster vaccination. And the reason for vaccinating people in pregnancy is because pregnant women are at a similar risk of COVID-19 infection as when they're not pregnant. If there are high rates in the community, that means the risk of infection is high. And there has in the past been a higher risk of severe illness in pregnancy and early in the postpartum period. That is probably less a concern with the current variants of COVID, but certainly that has been an issue in the past. And certainly in the past, there were very significant risks of pregnancy-related complications compared to non-pregnant women, including things like placentitis and stillbirth. Happily, in recent months, that has not been an issue. But nevertheless, COVID-19 vaccination remains an important intervention to offer during pregnancy, and to have that discussion and to allow the person make the most appropriate decision for themselves. Of course, making that decision involves the person balancing a number of things. Obviously, they're concerned about having sufficient immunity and protection against the particular illness, but they balance that then with the potential for complicating their pregnancy if they were not to be vaccinated and were to acquire the disease. Or indeed, if they were to be vaccinated, they worry about the potential risk this has for complicating pregnancy. So pregnancy is a complex time for decision making, and because, as my very first slide said, patients will say, well, this doesn't just affect me. And indeed, my colleague Sarah Geoghegan collaborated with a number of people, both here and in other jurisdictions, looking at the barriers and facilitators to maternal immunisation. This narrative synthesis has been published and shows a number of things that influence the uptake. So it's not just a simple recommend the vaccination and there will be routine and universal uptake. It's important to look at the things that influence this. So people's own knowledge and awareness of vaccines and diseases, people's ability to access healthcare. And all of these things kind of interplay together. People's birthplace and language proficiency, people's perception of the risks and benefits of vaccines, people's race and ethnicity impact, as does whether they have received a specific and explicit recommendation from their provider and had the opportunity to discuss with their provider the benefits and risks of vaccination or indeed of not being vaccinated. And obviously the ease with which people can access vaccinations also really important. The same research group looked at the attitudes of pregnant women towards COVID-19 vaccine, and this was just a month or so before the vaccine came on board early in 2021. And really what was identified then in this qualitative review of people's attitudes was that the safety of their unborn infant was the major driver for pregnant women when deciding whether or not to receive a COVID-19 vaccine. Certainly, the exclusion of pregnant women from vaccine trials left at-risk pregnant women facing a more complex decision than that facing non-pregnant people. And we concluded from this study that women should be supported with clear explanations from trusted healthcare professionals so that they may make an informed choice, guided and supported by an expert interpretation and provision of all the available data. Equally, Sarah Geoghegan authored this study on maternity care providers' acceptance of a future Group B strep vaccine. And this was a qualitative study carried out in Ireland, the US, and the Dominican Republic. And this was interesting because she concluded that targeted educational efforts with antenatal providers should focus on highlighting safety data and potential benefits of vaccination over current strategies. And it was important, this study identified the importance of really ensuring that healthcare providers were adequately informed about all the nuances of the various illnesses that they may be recommending vaccination for, in order that they can share appropriate evidence-based information. Because certainly it has been shown previously in Ireland that healthcare provider recommendation is a powerful tool for improving vaccination uptake. The other different things that have been identified are that different providers may have different approaches to vaccine communication. Some people would identify themselves as advocates, whereas other people give the information and sort of give the patient any information they require, but don't really recommend one side or the other, which may be important, which may be the right way to do it, as long as you give all the various aspects of information and the full complement of information. Providers also in Sarah Geoghegan's study identified that there was variations in their sense of obligation to recommend vaccines. So some people felt very strongly that our role as health care professionals was to recommend vaccines when there was a relevant evidence base, whereas others felt it was just about giving the information. And certainly the impact of people's understanding or perception of the various risks and benefits does impact on provider recommendations as well. So I suppose we're not just looking at patients when we're talking about recommending vaccination. It's also really important that staff are educated. So that is why I suppose events like today are important, to make sure we all have the relevant and up-to-date information. Certainly, it's really interesting when you look at patients likelihood of accepting or otherwise a vaccine. So there is a sort of a continuum, and apologies the way the slide is displaying because I can't use slideshow on this. It's a little bit difficult to see all the writing, but certainly in terms of the spectrum, there are people at the left side of the screen there. I absolutely don't trust vaccines and they're not going to have any vaccines. They refuse them all. And at the other side, there is accept all. So people who just take a vaccine regardless of information, and they're probably rare, particularly in pregnancy. Really here in the middle is where skilled communication with informed healthcare professionals can influence decisions. So this is where people are wondering whether they will take it. They have their doubts, and it's about facilitating healthcare providers to inform people appropriately in a way that the person can understand. So at the bottom of the screen, I have a link there to My Health, My Language on the HSE website. So important that we break down as many healthcare access barriers as we can, and using good information, up-to-date information, and accessible information, and having the time and resources to facilitate people to access the information in their language is really important. I work in the Dove Clinic in the Rotunda Hospital. So this is an antenatal clinic which provides antenatal care to pregnant women with infectious diseases and also pregnant women with addiction. And in that clinic, over the past number of years, we have run, in collaboration with our colleagues in Safety Net Inclusion Health, we've run vaccination clinics. And we published in the Irish Medical Journal of our experience of a few consecutive vaccination clinics. So this was in conjunction with antenatal care. People came for their antenatal care, and instead of just being recommended to have, at that point, it was flu and pertussis vaccine. So instead of just being recommended, we actually recommended and offered contemporaneously with an antenatal visit. And in this published work, we identified, we had 76 eligible women in the clinic who were eligible to either receive flu or pertussis vaccination or both. And interestingly, excuse me, in the context of recommending and offering eligible women vaccination, only 12% declined one or both vaccines. The vaccine people were more likely to decline was the flu vaccine rather than pertussis, because when they had the information about the impact of pertussis infection in the neonatal period, they determined that it was appropriate for them to be vaccinated. So this just shows, if you make the vaccine accessible to people, that does improve uptake. And I think it's really important as we design and as we develop and design other areas of the health service, that we really make sure that we make vaccination accessible in the places where people are going, particularly in pregnancy. You know, it's a short period of time, and it's important that we make it accessible. However, we did do a very good job in terms of COVID-19. Some of you may have seen some reports on the Embrace report, the UK and Ireland maternal death inquiry. And while 14% of maternal deaths, so these were deaths during pregnancy or up to 6 weeks after childbirth, were related to COVID-19 in the last triennium, there were no maternal deaths in the Republic of Ireland. And that is really, really testament to the impact of education and awareness raising around vaccination. But the maternal death inquiry also highlighted the important gaps really that can harm vaccine uptake and availability. And really what they advocated for was that pregnant women had equity in terms of participating in vaccine research and other pharmacological research, that there should be a route for rapid delivery of advice and data on new vaccines and treatment, that we need to tailor care after pregnancy to a woman's individual needs. So just because she's no longer pregnant, she may still carry some pregnancy related risks. And certainly a number of the women who were reported as dying early in the or within this triennium died early in the postpartum period. They also recommended that staff in maternal medicine networks had the skills to care for complex physical, mental, and social care needs. And indeed, they also recommended training resources to promote shared decision making and counselling on medication use. So instead of just having a blanket, this drug isn't tested in pregnancy, therefore we don't use it in pregnancy, to actually have shared decision making to afford people the opportunity to receive a particular medicine. So I hope that was helpful. In summary, vaccination in pregnancy is a really important intervention, but it's very, very important that we give people evidence-based, accessible, plain language information in whatever language or format they require it. We as healthcare providers are a trusted gateway. Research here has shown it, international research has shown it time and again, that healthcare provider recommendation